I think we can start now. So as I said, hello everyone, and really welcome to the Educating for the Great Transition parallel session. It's a great pleasure to be here with you today and to see so many familiar faces and friendly faces and some new faces that I like to call our new friends and future friends and collaborators. It is, in the next 90 minutes, we will explore all things planetary health education related. We will talk about where we have been, where we are, and where we are headed. And this session is especially meaningful because it coincides with the 10th anniversary of the planetary health movement and the planetary health framework. And who better to take us on this journey down the memory lane than our old friend and dear friend, Dr. Teddie Potter. Teddie is a nurse, an educator, planetary health trailblazer, and a constant source of inspiration. She will take us on this journey and reminding us how far we have come and why education sits at the heart of the planetary health movement. Please join me in offering her a warm welcome.
I didn't hear people shout and clap at 10 years. I want to hear it. We'll bring those hall people in yet, right? Okay. So, this is kind of high. It's not made for short people. 10 years, just think about that. And you might be feeling very, very frustrated that we're not going far enough, fast enough. But I remember the days when I would say, I'm really interested in planetary health. And people would say, ha ha, are you caring for Jupiter and Saturn right now? I haven't heard that comment for a long, long time. That means that planetary health is starting to gain a threshold and a language. I'm serious about that. People really made a lot of fun about it in the beginning. And the reason we've been able to travel as fast as we have and as quickly as we have is because of planetary health education. Now, I'm not just talking about kindergarten to 12th grade primary education or secondary education or even postgraduate education. I'm talking about having time to teach this to every single person that crosses our path. That means that I am constantly saying to people, have you heard of planetary health? Do you know about planetary health? It's our role to teach people and educate people. And we'll be talking a little bit about that today. So I was involved in shortly after the beginning. The beginning was 2015, and I came into the practice or the movement about 2018. And as we got together, we said, well, what is the work that needs to be done? And we came up with these 4 sort of pathways of action. We needed sustainable practices. We needed to develop knowledge in this area. We needed to really be able to communicate well and tell the story well. And we needed to be advocates and movement builders. That's great. Does everybody agree that that's what we need to do? Yes, yes, these are great principles. The trouble was, we did not have a shared language. So we had all the people gathered together, but we didn't have a language where a nurse could talk to a farmer and to an engineer, and us all have the same way of moving forward. So we decided we needed a shared language. And we assembled 24 experts from around the world, all in different fields, and we said, what do people in higher education, your students in higher education, what do they need to know in order to move planetary health forward? And guess what? We developed a list of 500 things. Now, how many educators are going to add 500 things to their curriculum? It's just not going to happen. So we practiced the art of winnowing, throwing something up and seeing if we could catch the grain and let the things that weren't necessary float away. And so we came up with 5 core domains. Those 5 core domains make up our planetary health education framework. They include interconnection within nature. If we do not get that right, nothing will work. It's not that we need to reconnect with nature because we're separate. It doesn't mean that we're above nature. It means that, and I have to put my microphone down for this. Okay. We are the same thing. What you do to nature, you do to humans. We are nature. That understanding is essential because when we started splitting out as humans that we're separate from nature, we're better than nature. Nature is something that provides, and I hate this term, ecosystem services. It's only important if it provides a service for us. That's when we started destroying everything. We were destroying things that we didn't realize we were destroying ourselves. So interconnection within nature, the Anthropocene and health, these are human-caused problems. They're not natural disasters or acts of God. They're things that are acts of humans. And if we don't understand that, we are going to be not correcting the right thing. We need to correct human behavior. The third is equity and social justice. It's not a side gig, it's not politically correct to add it in. It's essential that our solutions work for everyone. The fourth is systems thinking and complexity. We have to understand that you need to consider for every solution, everything you propose, that you question how it will impact other parts of the system. And then finally, movement building and social change. Those are our 5 core domains. Now, a lot of us in academia are used to if you produce something and then something else comes, it just shoves the old away, and then the new stands there, then it shoves the old away. I want you to encourage all of us to understand that these education pieces do not replace one another. They're like a beloved library. Keep them on your shelf. We need this shared language, which is the Planetary Health Education Framework. It allows us to talk across disciplines. Okay, great. Now we have a shared language. Now I know what you're saying, and we can work together. But if you don't have a shared vision, you're going off in different directions. So the shared vision is our Sao Paulo Declaration on Planetary Health. And this was released when we had the Planetary Health annual meeting virtually because of the pandemic, but the University of Sao Paulo is the host. And it is our shared vision. If you have not read the Sao Paulo Declaration on Planetary Health, it is spectacular. It's a blueprint for every sector. And where did we come up with it? How did we come up with it? It was crowdsourced. It came from all of you. You told us the future that you want to see built. You told us how healthcare has to be transformed. How does education have to be transformed? The built environment. How do political leaders have to shift and change? How do how does research need to happen differently? Make sure that is in your toolkit. It is our shared vision. More recently, in 2024, was released the Planetary Health Roadmap and Action Plan. So now we have a shared language. Now we have a shared vision. But we need some shared strategies. And that's what the roadmap is. It talks about how do we transform governance, how do we transform education, and how do we transform business. The 3 areas that have the biggest impact on where we're going. So, that brings us today. Today we're pulling together the education pieces on how do we transform education. You're going to be hearing my colleagues talk about planetary health curriculum, the global nature of planetary health, a video story telling experience. Let's teach planetary health webinars and what was going on, and then a policy toolkit. We'll be pulling it all together for you the rest of this session. But where are we going the next 10 years? What are the next 10 years going to hold? And I would draw this, your attention to this, because it all depends on you. It depends on you showing up, making sure that you understand it's your responsibility to bring the shared language, shared vision, shared strategies, and educate everybody you can to move us towards this better future. It's absolutely possible, and we need each and every one of you. Thank you.
And the next part of our session today is a conversation with our amazing panelists. It is my great honor to welcome both in person and virtually our panelists, Dr. Husein Moloo, Dr. SanYuMay and Dr. Hina Shan, who is joining us virtually from Pakistan. Our panelists will share concrete experiences of bringing planetary health education into diverse educational settings. They will offer powerful examples from around the world. And the conversation will also highlight practical approaches and lessons they learned while becoming the success stories they are today. So I would like to begin by introducing our panelists. I'm gonna just offer some important short biographical information about all three of them. Dr. SanYuMay is a true international leader in education for sustainable healthcare and planetary health. She combines her years of practice as family physician with expertise in environmental science and policy. It has the rare award of Principal Fellowship of the Higher Education Academy. SanYuMay led the development of the very first education for sustainable healthcare curriculum to be endorsed by any national medical educational body. She then established and chairs the UK Medical School Council's Education for Sustainable Healthcare Alliance. At the University of Oxford, SanYuMay teaches planetary health and sustainable healthcare and is a fellow of Green Templeton College. Globally, SanYuMay is involved on the boards of many significant initiatives and is a much sought-after keynote speaker. Dr. Hina Shan is an assistant professor of public health at the National University of Medical Sciences in Pakistan and managing editor of Life and Science. She also served as the regional hub representative for South and Southeast Asia at the Planetary Health Annual Meeting in Kuala Lumpur. With over a decade of academic experience and medical background, her work spans antimicrobial resistance, climate and vector-borne diseases, and planetary health education. Hina has led school-based advocacy campaigns and published widely on issues such as air pollution, climate impacts, and the role of clinician leadership in advancing sustainable health systems. And last but definitely not least, our dear friend, Dr. Husein Moloo, is a colorectal surgeon and professor of surgery at the University of Ottawa, where he also serves as the inaugural director of planetary health in the Faculty of Medicine. He advises the Royal College of Physicians and Surgeons of Canada and co-chairs the National Planetary Health Committee of the Association of Faculties of Medicine of Canada. Through his work in quality improvement and patient safety, Husein has come to appreciate the intersection between quality improvement and planetary health and is involved with a number of educational, research, leadership, and knowledge translation activities in this area. And with that said, I prepared a list of questions for this panel, but then I was a panelist earlier today at the lunch panel on planetary health education organized by ASFER, and it was a wonderful panel. However, we ran out of time for the audience to ask their own questions. So I will start this conversation, but then I ask my dear colleagues sitting in the first row to alarm me when we have 10, 15 minutes to the hour, and then I would like to invite your comments, questions, and suggestions. So did you have a chance to scan the code for Slido? No? Can we please just, Hina, and I'm so sorry to just share the screen again, but if we can get, please, I'm gonna just step aside so everybody get a chance to put those questions in. Okay. Great, thank you very much. And now we would like to have Hina back, please. And I will go and sit to have this conversation makes more sense. Sit together. I want to start by thanking you, SanYuMay and Husein and Hina, for joining us today and for bringing your voices and your expertise to shape this important conversation. I would like to start on a personal note, and I would like to hear about your background a bit, about the setting you work in, and more than anything, I think it's so important to hear about what approached your general education or your general feelings or about the education. What is that brought you to this? First to the education in general and then planetary health education. SanYuMay, let's start with Hina. Yes, that's a great idea. Hina, would you like to go first?
Hello, everyone. Good evening. Am I audible? Okay, so, as you've introduced me, I'm a public health professional with 12 years of experience in academia and a medical background. And I spent much of my career working on antimicrobial resistance, public health, and One Health. But in 2021, I discovered the Planetary Health Initiative online, and it immediately resonated with me. It brought together everything I cared about, people, the environment, and Earth's natural system. So, given that my country, Pakistan, is highly vulnerable to climate change and disaster, ranking among the top, most polluted regions, despite contributing less than 1% to global greenhouse gas emissions, we were like facing erratic climate changes, floods, agricultural devastations, and that Pakistan is home to more than 10,000 plus glaciers. So the gradual rise in temperatures is forcing the melting of these glaciers and increasing the risk of flooding. In 2021, when we experienced the floods, devastating floods, I mean, that was the point where that hit me, and it was like I need to, take it personally and strengthen my commitment to take action. I learned through, Planetary Health Alliance, because there were resources available and there were webinars. So education to me is an exchange of ideas, a process that connects teaching, research, and learning. So it's a lifelong journey, and I learned through PHA from people like, Samuel Myers and Teddie Potter, Jamila Mahmood, Professor Dr. Jamila Mahmood, and after those floods, I involved my students, engaged them in a school campaign on climate action and planetary health. When you're engaging students, you need to, let them go into the field in the community. So we did some research projects where we did one of the research where healthcare professionals were involved, and we asked about pro-environmental behavior in relation to planetary health. Then there was a school-based knowledge on microplastics and planetary health. This is still going. And also the health implications of rising temperature in outdoor workers and community-level perception of planetary health in flood-affected regions. It's a mixed method study, and the data, collecting the data was very, very difficult, because in low-income settings like ours, health literacy, health literacy and literacy in general is not, equally distributed. So people, it was very difficult to make them understand, because the terms planetary health and, Earth's natural system, they're very difficult to translate and, get the message and get, their understanding. So that was something very challenging. And in 2025, we have had the geopolitical situations here. So for me, peace and planetary health, this is something really new. And I believe that peace this year, it was, yes, floods were there, but peace is something that that is very, very important for planetary health. We need to work together, live in harmony with the nature and amongst each other. So that's it. Thank you. Thank you, Jelena.
Thank you, Hina. SanYuMay, would you share a bit about what shapes your approach to education?
Yes, can you hear me? Good. So I think I have a slightly different background in as much as being a medical doctor who also did a postgraduate degree in environmental science and policy. So I came into this space because I wanted to change medical education but felt that I should know what I'm talking about, which is why I went to grad school. And also, as you mentioned, I'm Principal Fellow of the Higher Education Academy, so I am an educator at university level and recognised at the highest level for that. And so I combine those things and try and disseminate as widely as possible and try to bring those things together. And then yeah, I mean, basically try to act both nationally and, as far as possible, internationally.
Thank you. Husein?
Yeah, well, first of all, thank you so much for having me on this panel. The one thing you'll realize from the introductions is I'm definitely the least qualified. And while SanYuMay is both an educator and has did a postgrad degree in environmental science so she could actually feel like she could educate people on this. I, on the other hand, as a colorectal surgeon, have no environmental background and am not recognized by any educational body as being a fellow of higher learning. But I guess, what I bring to this is, you might say, yeah, how does colorectal surgery interface with planetary health? And I get that question a lot. So I started in quality improvement and patient safety. So in surgery, that's like, how do we have less people die from surgery? How do we get less surgical site infections? How do we decrease the length of stay? And in a way, when you think about it on a more philosophical level, that's all planetary health as well. But I was leading that for our department for a while. And then eventually, as I led that for a while, I wanted to keep our people engaged. And so I tried to intersect that with other societal issues. So, we looked at opioid prescribing, and surgeons are not responsible for the opioid crisis, but we contribute to it. So we looked at that. We looked at surgeon empathy, and then we looked at decreasing our carbon footprint. And like most things, things are kind of, timing is one thing, luck is another. I'm a pretty simple-minded person, this most simple-minded on this panel for sure. And as a surgeon, it was just, this is an issue, and I'm really old, and my filter is broken. So I had no problem bringing this up with CEOs, department heads, and that's where this Director of Planetary Health position came from. That's where the position with the Royal College came from. And so that's how my educational platform started, without any educational or environmental background.
Thank you, Husein. And I'd just like to ask more about your personal experiences. Obviously, when I was reading your short bio, your short bio is so impressive, SanYuMay. So when you look back at all the success you had, what is one thing that you are most proud of, that you think you did, and it had like a really biggest impact on planetary health education?
You don't ask any easy questions, do you? And Husein, I don't agree with you, by the way. I think that being a colorectal surgeon is very important because you have the voice that everybody wants to listen to. So I really don't agree with you about.
We all disagree with you, Husein.
So I think, thinking back to what came to the front of my mind is a three-letter word. It's a three-letter word, and it's a small word, for, F-O-R, because what is it, for why are we doing this? What is it for? And so it used to be called sustainable healthcare education, which was very ambiguous, and was the education sustainable or was the healthcare sustainable? So in my faculty development paper, so the Fulfilling a New Obligation paper was about how to bring in teaching and learning of sustainable healthcare into the curriculum, and that was from my research. And then I collaborated on a faculty development paper because I was asked to talk about faculty development. I spend a lot of time actually teaching the teachers how to teach a subject that they're not necessarily familiar with. So they may not have heard of planetary health, and they may have the wrong ideas of what sustainable healthcare is. And mostly they do. They think it's well, I shan't go into it. But so in my faculty development paper, I said education for sustainable healthcare. And I said that this encompasses planetary health. And this was 2020. And so in the AME consensus statement, the International Association for Health Professions Education, that was taken up. And so the definition, or what we're talking about now, is the nomenclature has become ESH, Education for Sustainable Healthcare. And the paper, the AME consensus statement paper, says planetary health and education for sustainable healthcare. So that's the consensus, which is fairly global, 5 continents, and many educators at all levels, including students, and all over the globe, lots and lots of health professions. And the journey of that little word, for, I think, is what probably has had a lot of impact, because it went from the faculty development to the AME consensus statement to the Medical Schools Council, which is the umbrella body of all of the UK medical schools, and establishment of the Alliance, so the Education for Sustainable Healthcare Alliance, ESH Alliance, and then on to the medical regulator, who's taken that terminology, education for sustainable healthcare. And being in this conference, and we're talking about planetary health and what's it all about, and of course, what's it for? Why are we here? It's for planetary health, and planetary health is for everybody. So the slide up there at the previous session, it was saying public is for the people, and it's for everybody and for all of life on Earth.
Thank you. And I would like to ask Husein, when we were preparing for this panel, I had this question about advice, and he was not comfortable with that as well, that he would be someone giving advice. So that's why I have decided to ask him this in this panel. What lessons have you learned, and what advice, looking at the success of the Planetary Health Declaration of AFMC, and all the work that went into that, what advice would you give someone who is trying to replicate that success in their setting?
So, yeah, that's very kind of you to ask me the question that I didn't want. I think, there's obviously a lot of different challenges. I think the number one thing that's gotten me through all this, I'm up here, but everything that I've been involved with has first of all involved a team. And from my QI and patient safety background, I think one thing I'm decent at is building teams. And I think that's, I'd say that's my number one piece of advice, because you can't, look at this conference, you can't do this alone. You need teams for everything. And whether it's a curriculum, whether it's designing new accreditation standards, you need a team. And so that's one piece. And I think the other thing is especially, everything takes a while to get done. And it's finding the people who can make the decisions so you don't waste a lot of time. Maybe waste is a wrong word, because hopefully, we're doing something meaningful. It's not really a waste. But, if I give you an example, if I want to change the accreditation standards for every medical and surgical specialty in Canada, which we are doing to include planetary health. The way that works is I can't have a bunch of conversations with people who can't make decisions about that. I'm going to go speak to the CEO. I'm going to go speak to the board of directors. And then those conversations will get me to where I need to be to change those accreditation standards, which we'll be changing next year. If I want to change my medical school curriculum, the conversation needs to be with the person that runs that curriculum, not with everyone in between, but I want to have that conversation with the person who can make that decision. if I want to incorporate planetary health into QI, I thought it was having a conversation with the person who ran QI at the hospital and does it for like everyone, physio, OT, nursing, residents, physicians. It wasn't. They were like, we can't do that until the strategic plan for the hospital changes. So that's great. So then I know where to go. So then I go to the CEO of the hospital, the board of directors there, and we change the strategic plan of the hospital to include planetary health. And so I think my other piece of advice would be find out who can make the decisions. And I mean, there's a really great book called Getting More. Sounds very materialistic, but it's all about negotiation. It's by Stuart Diamond. It's a great book. And I think for us in this space, knowing how to negotiate, finding the decision makers, and then having that team to back you up, I think that's a winning combination.
Thank you. And I would like to ask Hina, we talked about success as well preparing for this panel. What does it mean to be successful? Does it look the same across different cultures and settings and contexts? And I believe it does not. And I think that each set of settings we work in comes with its own unique set of barriers and issues and problems and people to convince. So I would like to ask Hina about the barriers. How do you do that? How do you deal with the barriers you encounter?
Thank you, Jelena. Well, barriers in, I mean, we have at an institution level, people understand you. They kind of buy your idea and they try to, facilitate you. For example, if it's to start a new course for climate action and planetary health, they would obviously let you go through it. I have been able to, put it in my strategic plan because I was developing it, so I could, convince the top leadership. It was very easy. At institution level, it's easy. At national level, especially for countries which are less developed, developed countries have, stronger system to address environmental issues and they can protect their populations. But achieving similar progress in low-income countries is far more challenging because obviously there is limited resources, fragmented governance, and you cannot just implement it very easily. There needs to have, you need to have a political will. Though our government is trying its best, but at institutional level and at individual level, it was very, very easy. Even at community level, it was easier to, teach them, though language is a big, big barrier. For us, it was a rural setting, and teaching them about planetary health was so very challenging. You cannot translate these terms in our language and make them, simplified because obviously English is not their first language, and it's a complex or process or terminology is difficult. So making them understand where the literacy rate is poor is very, very, very challenging. So language barrier is something very important when discussing planetary health concepts. And you connect with people across cultures, disciplines, and regions where communication is essential. You need to, you have to have multilingual resources. Translation of key terms was very, very difficult. That was one barrier. Inclusive communication strategies, because I was working with my students and it was, difficult to, having less resources, it was difficult to make it work. So these are a few challenges and barriers.
Thank you, Hina. And Hina mentioned language as one barrier, and we talked also about scaling up planetary health education, expanding for beyond individual institutions to the national level. And just to stay a bit in this realm of talking about the barriers, what do you think how can collaboration across disciplines and institutions strengthen that? Like, what is the way to do it? We've been doing it for a while, and I'm happy to say I've been part of this community for 2.5 years, and I have seen growth and change in that time. But I would just like to see your perspective. What do you think is the way to go forward? Yes, Husein, please.
Okay, so across disciplines, the way forward. I mean, I think, I think, and again, you know, I believe in pluralism. There's a lot of different answers to this. For me, what I think is most effective and to accelerate things at scale as quick as possible, meaningfully, is to take advantage of current infrastructure that exists. I think sometimes we need to build new organizational architecture, but I'll give you an example of what I mean. So again, and I'm going back to, you know, where I'm comfortable, QI and patient safety. So in Ontario, for example, so population of 17 million, decent size, we have a quality improvement collaborative. Now, that collaborative has 50 hospitals. We work on stuff, like I was telling you before in the past, surgical site infection mortality, enhanced recovery pathways. But with some education at our, you know, semi-annual conference, and with kind of targeted meetings with, you know, the kind of provincial government, as well as, you know, important like nursing, administrative, surgeon champions, anesthesia, like again, across disciplines, you know, we were able to launch in 2023 this Cut the Carbon campaign. So, you know, that's like 50 hospitals working on like things to be more, you know, that are environmentally friendly, that are sustainable. And that's like, again, incorporating a number of disciplines and using the architecture that exists. That, we usually run our themes for 1 year. People were so engaged, because I think what we have in the planetary health community is like a platform that resonates with a lot of people, I mean, based on surveys. So when you give people this opportunity for eco-action, I mean, that really is one of the antidotes to eco-anxiety, as we all know. So they jumped all over this. And it was so meaningful for so many people. So many people came out and said that this rejuvenated their careers. Even people at the provincial level said this. And so, you know, we've taken that. It's run for a second year. Second year is really good. Now it's called Cut the Carbon, Built to Last. And it's going to be built in from now on going forward. Now you might say, okay, well, nationally, how does that look? Well, then we take that and we take that to Alberta, take that to BC. And we recently launched in the US, of all places, the SUSTAIN Collaborative through the American College of Surgeons, which they were scared to launch, but still did, have a soft launch, and we have 50 hospitals signed up. So again, I think these are ways that you can, you know, we have it's such a great idea, right? I mean, it's so palpable for everyone now. I mean, I think it's just with a bit of education and the platform we have, it engages people. Yeah.
SanYuMay, what is your take on how we move planetary health education beyond individual institutions that are so successful in doing it?
I think in my experience, it's actually been quite successful to do it at a national or international level. There's a lot of enthusiasm within institutions, but that actually depends on a champion within one institution. But when you can get it across a number of institutions and take it to the national level and get it into a national body, I think that makes all the difference. And to make it official, so in the UK, where I am, there's the Medical Schools Council you mentioned, and it only has 4 branches or alliances, and Education for Sustainable Healthcare is the 4th alliance. So it's quite something to have achieved that with buy-in from every UK medical school, and they've nominated representatives, and we have regular meetings. We've taken people away for 2 days to talk amongst ourselves about how to implement this further. And that enthusiasm is about collegiality rather than, not so much collaboration in the medical education space. I think in research we talk about collaboration because you need collaboration to increase your potential for funding. But I think collegiality is more important than collaboration in the research sense. you need to help each other and show each other how you're doing things. And then, of course, in the international level, so we have the European Network for Climate and Health Education, where there's somebody here representing that. And, you know, sort of, that's European level. We've got the Planetary Health Report Card at an international level. We've got the national ones, so for instance in Germany, that I might ask to speak about it later. So yeah, collegiality and helping each other.
And I would just like to, before I move to the questions from the audience, I'm going to skip some of my questions, but I would like to ask all three of you one wrap-up question, and that is, what can a person do at the individual level? This is something that I always ask myself. Like, I think we start with values. I think if we start with planetary health values and we embody those values and we bring them to our professional settings, that's the really first good step. But I would like to hear from you, really, what do you think are these practical on-the-ground actions that individuals can take within their institution to foster a culture of planetary health? And Hina, would you like to go first?
Sorry, could you just repeat your question? Really sorry.
Yes. My question was, in your view, what are these practical, on-the-ground things that an individual can do to really foster the culture of planetary health at their institution? So something that you can do the moment you come to work in the morning, you are there with your colleagues. What is something that one person can do? We heard earlier today about that the change starts with one person, that any movement starts. How does that institutional change start? With what individual steps?
I think everyone can contribute to planetary health, whatever is there, within their sphere of influence. And by actions, I mean, if you can, I mean, we have this group, a WhatsApp group in our organization, and there we share everything that we do. For example, if we have walked to the organization, walked to the, university, we share that today we kind of, on a personal level, did our part and we did not use the vehicle. And if somebody comes on electric bike or they have bought a new one, they share it there. Water shortage and scarcity is quite a problem in Pakistan. So we share about how we are, saving water every day. So every day we kind of share whatever we are doing on a personal level, and the group is getting bigger and bigger, and we kind of get cheered up by our colleagues, and that's how, by sharing what we are doing, it makes you mindful of the fact that every act you do is saving the planet. So that's what we do. If somebody uses plastic bottle, we kind of grill them up that you're not supposed to. We have put glasses, glass glasses, and sustainable measures like these. So we don't use disposable cups. It's zero waste. Our organization is zero waste. So I mean, that's how we motivate each other. And if we do a project or a publication, obviously, or research, that motivates them. And then I must say that we were having this smog issue in Pakistan. So I learned about air pollution and its effects via Planetary Health Alliance, because obviously I have a medical background, not some deep learning about environmental sciences or anything. So I learned about it, and then I wrote about it, and then I shared with my colleagues, and it was very well taken. And there are people who have allergies, and it was so very well explained why allergies are being, aggravated due to air pollution. We never knew that, and what is, ground level ozone. So these kind of things, I think individually, this is something we all can do.
Thank you, Hina.
Thank you.
SanYuMay, what do you think an individual can do in an institutional setting to foster the culture of planetary health?
Yeah, thank you. I guess because this is an education session, and in education, if you ask a student to write an essay, or if you even have a researcher writing a paper, they don't start from scratch. They look around them. They see what there is already. They look at the literature. They look at institutions that are already doing other things. And you don't reinvent the wheel. You look around and see what there is already and try to build upon it. And I think if you're in this space, you try to build upon what there is already, reach out to others who are already doing it. And you don't have to start up something. You can reach out and say, how can I help you? You have an initiative. I can help you because I'm interested in this as well. And then maybe institutions could collaborate at that level, or you can just help along other initiatives. So you don't have to feel that you're on your own within one particular place and have to start from scratch.
Husein?
Yeah, I don't really have much to add, I don't think. A lot of you probably have heard of Katharine Hayhoe and her book, Saving Us. And in her last chapter, that's the question that's basically posed. And what she says is, and obviously she's pretty awesome, she says, just talk about it. And I think, honestly, like when you're talking about culture, culture is like how things are done, where you are. And if everyone's talking about planetary health, I mean, every word that is uttered into that environment, I think, shifts the culture. And so, I mean, this is an elevated crowd, obviously. Many of you probably, like, I mean, put a lot of money on the fact that a lot of you know more about planetary health education than I do. But, you know, I'd say, and then find your people, find your team, find out what you're interested in, what really, I mean, we have, you know, we have like 4,000 weeks on average to live. So, I mean, time's pretty precious. Find something you like, find the people you like working with, and then just enjoy the ride.
Thank you. And now I hope we have some questions on Slido. I'm just going to give this.
Okay, we have quite a few questions. First one is, nurses are the largest group of healthcare professionals worldwide. They're at the front line of patient care and make a huge impact on addressing climate change and health. However, nurses are under pressure and lack time for education. What is your advice about supporting them?
May I direct this question to Teddie? It's just, you would be a perfect fit to answer. Nanusha, can you?
Thank you for that question. And we are the largest health profession in the world. And we also are the most trusted profession in the world. So you really want to target nurses because we are trusted voices to get messages across. What can we do to teach nurses? We need to focus both on nurses that are being educated currently. So I mentioned some of those things this morning about movement building. But we also need to make sure that we bring everyone along. The people that are currently practicing also need to be informed. And I think the toolkits and the things that are going to be mentioned this afternoon, they're discipline naive or neutral. They're not targeted. So all the things I mentioned, the Planetary Health Education Framework, the Sapala Declaration, that's for all of us. So nurses need to participate with each other, need to be part of this. But if you want to get even more involved, pay attention to what's happening in the International Council of Nursing. Thank you.
Thank you, Teddie.
Okay, next question. Many schools have created graduate programs in planetary health. However, there are not a lot of jobs that explicitly look for people with this background. Do you have any thoughts on this?
Do we have any thoughts on jobs, SanYuMay?
Yes, I think it's a growing field. People are recognizing planetary health, and it's really part of the ethos of rising generations of people coming out of education. I think there's massive need for knowledge and implementation of planetary health values, and it chimes very well with a lot of people coming into the world of work.
Great, thank you. How are educators from a colonial context teaching epistemological humility and diversity to actively integrate the philosophical great transition? Big question.
That's a great question. Hina, would you like to try to give an answer to that one? Do you want us to repeat?
I would want you to reiterate the question, please.
Okay.
Yes.
Yeah. So
And loudly, please.
how are educators from a colonial context teaching epistemological humility and diversity to actively integrate the philosophical great transition?
Oh, God.
Oh my, you are tough.
So, okay, I'm going to give it a try. Yeah. So, I mean, Teddie once said that we are in this boat together, right? This boat, this planet, we are all in this together. So for each one of us, everybody who's inhabiting this, planet, Earth, we have this shared responsibility to save and protect it, we see destruction and wars and fights and conflicts and fossil fuel burning, and the planet is burning and it's deteriorating every day. And we need to, empower us to, save whatever is left. I mean, though time is running out, but there's no planet B, but there's still, we can do to protect this place for our future generations. And we have to be, as I earlier said, we have to, live in peace and harmony with each other and with the planet and the resources Earth's providing us. Thank you.
Thank you, Hina, for trying. And let's hope Anusha has a kinder question coming our way.
I think this should be a bit kinder. We have quite a few questions focusing on how a lot of teaching on planetary health so far has focused on the university level. So there's one question, how do we also involve primary and secondary schools?
And this is something, for those of you who were earlier in the Ask First session, I mentioned that it's something that when I started, and I will take this, also I'm not a panelist, because when I started my role as the education director with the Planetary Health Alliance, it was very clear that I'm supposed to focus, that our plan is to focus on public health, nursing and medicine with the idea that we are going to expand. And now 2.5 years later, I feel we are there. And when we talk about expanding, we talk about expanding across disciplines, because talking about the great transition, if we are really to change the way we live on this planet, it's clear to me that we don't know how to do that. We need to learn how to do that. And if only nurses and doctors and public health professionals learn that, what does that take us? So we all need to. But then do we wait? And I talked to my dear friend who runs an amazing graduate program in planetary health at the University of Catalonia about that, how important it is to have these amazing graduate programs, and we have 34 of them that I'm aware of. But then we have to start earlier. And now, as all of us have this expertise in higher education, what we are trying, and I'm going to take this opportunity as well, and then later we're going to invite you to contribute to this, to really invite people with expertise in secondary and primary education, because we do have some of the resources out there, and I invite you to check out amazing planetary health education posters that were created by Jennifer Rasmussen, who is a PhD education fellow for primary and secondary education. We have an amazing ebook giving examples of how educators in Latin America are approaching teaching planetary health at the high school level. But we need much, much more. And this is really our next step. So I just finished writing my strategic plan for the next 3 years, and I can tell you I want to expand this conversation across disciplines. We need to talk about planetary health for students of economics. So we stop talking about growth, GDP, 100 years on, it just doesn't make sense anymore. In the same way, we need to understand that if we we have to start talking about this at the level of where children are really still so connected to nature, so curious about nature. They don't have this thing that Teddie mentioned, how important it is, interconnection with the nature. But for them, that's just intuitive. They still haven't, haven't grown up and haven't had all this education. And they're systems thinker, as I believe everyone is before the age of 10. So thank you for that question, and I just really want to invite everyone who has this expertise to please find me or the members of the Education Action Group later and have this conversation.
Next question. Yeah. So after learning about planetary health fundamentals, healthcare professionals want more tools, protocols, prescriptions to be used with patients on a daily basis. Do we have planetary health solutions that can easily be embedded into nurses and doctors' offices?
I believe this is a great question for both SanYuMay and Husein.
Sure, I can take a shot at that. I'll delay by saying whoever made that epistemological question, congratulations on your vocabulary. It's very impressive. Yeah, there are a lot of, there's a ton of playbooks out there actually. And I think the playbooks come in really handy. Like when we, for our Ontario collaborative, we have playbooks for about let's say 15 different things in the perioperative space. We have, the Planetary Health Alliance, I'm sure has a lot of playbooks. We have something called Cascades in Canada, which has created a lot of playbooks. I know in the UK, the organization that was mentioned by SanYuMay, they have a bunch of playbooks. So they're out there. There's a lot of people doing a lot of stuff actually. It's actually inspiring when you get on there to see all the amazing work that's happening. So I think the short answer is yes, there's a ton of tool out there, no matter what area you're in basically now. And I think everyone has the opportunity to try and do something depending on, where they are in their lives and stuff. It can be tough to take this on sometimes, but yeah.
SanYuMay, would you like to add something?
Yeah, so to add to that, it's a question, I think, of being mindful of what you're doing and why. So you might just practice according to the guidelines or because of your patient's wishes or because it's how it's normally done. And those are quite dangerous ways to carry on in the world. I think one has to be mindful about what you're doing, why you're doing it, who you're doing it for, and in the longer term, whether you can carry on doing it if you're carrying on doing it just because it's done that way.
Another question, because we also want to hear from members of the Education Action Group, how we are on time. Okay, thank you.
One more question?
Yes,
yeah?
Let's hear another question.
I guess this is a fairly big question as well. Is current education complicit in the planetary crisis by teaching knowledge disconnected from the health of the planet?
I think we know the answer to that. Yeah. There is a gentleman over there with his hand up.
Oh, do we have a question in the room?
Yes. Yeah, that was you.
Oh. I don't press slide because I put in the question and didn't get asked. So my name is Kennedy Michael. I'm with the Governance and the Education Working Group with the SanYuMay Center for Planetary Health. I wanted to be part of the Education Working Group, but it was just too many things going on. And so I work at the grassroots, and my statement was planetary health education presents a wonderful opportunity to bring children into the sciences. I teach climate action and river ecosystem restoration as a community educator where I work at the grassroots. There are 4 schools, almost 3,000 students. We have a weekly volunteering opportunity where 1 hour is given to education about climate action and river ecosystem restoration. So now we've done 14,600 people. It's a very science-based program that we developed ourselves. And somebody asked a question about primary and secondary education. And by the time we wait for institutions to figure all this out, we've done something the entire government couldn't do with all the resources there. So time is very important. It's of the essence. And so you can't wait, right? So you have trusted sources, you work with scientists, and then because you have access to all these people who are interested, and we do this on a weekly basis, at least a minimum of 20 people every Saturday and Sunday. And ever since I got involved in the planetary health movement, we've added another layer to that education. So don't wait. I wanted it to be discussed, whether anyone else is waiting for institutions and governments to do stuff when you can just get up and do it yourself. Really.
Thank you.
It's all about that.
And with that, we're going to pause with questions here from our representatives of the Education Action Group, and then resume with the questions at the end of the session. So I would like to just, Hina, please stay with us till the end of the session, but I would just like to go back to our slides. If we can please get our slide deck back. And I would just like to say something about advancing planetary health education through the work of the Education Action Group over the last year. It's been a real honor of my career to have convened and work with this amazing group of educators. 30 plus planetary health educators have gathered to take the next steps that were laid out in the planetary health roadmap. And one thing we decided at the beginning, we'll not write another document. That was the idea, that we were like, we have the roadmap, as Teddie said, we have the education framework, we have the Sao Paulo Declaration, and that is enough. And now we wanted to take actionable next steps. And that's usually, you're not going to be surprised to learn, the tricky part. So what we did is we worked together. These people, or these amazing educators, and you're going to hear from some of them today, are all volunteers who dedicated their time, creativity, and amazing commitment over the last year to work on these 4 key deliverables while working in 3 subgroups. So the first one was led by Dr. Heidi Honegger-Rogers, who unfortunately is not here today with us. But I just want to really highlight the role she had in leading this subgroup on the curriculum guidelines, and her fearless leadership really brought us to where we are today. And we're going to hear from Jenny Cole, who's going to present the work of the curriculum guidelines group. And then the second group focused on the global nature of planetary health. And we talked a lot about science, and I think for Planetary Health Alliance, coming from the Planetary Health Alliance, for me, amplifying the science is such an important part of my work. But in the current climate, when science is under attack, and at the same time while we are defending the science, we have to use other ways of communicating in polarized settings. And I think storytelling is so important because it highlights the fact that we are all interconnected in these challenges that we face. And then we are not talking, when we tell stories, we are not talking about these abstract scientific concepts, but we are talking about families, communities, health, and even in the most polarized settings, I think people connect to that. So we will learn more about the deliverables of the global nature of planetary health subgroup. And then we had one subgroup with 2 deliverables. They were really hardworking subgroup on engaging educators and policymakers. This was co-led by Jennifer Cole and Stacey Vegas. And I just didn't mention, but Jennifer Rasmussen is here with us to talk about the global nature of planetary health. So without further ado, I would like to invite Jenny Cole to come and Peter Furu, and they will tell us about planetary health curriculum guidelines.
Good afternoon. Very nice to be here. I think Jenny will present the outline of the curriculum that we have worked on. I can just say a few words about my own motivation for being within the team. You know, since 2017, University of Copenhagen, from where I come, have been a member of the Alliance. And since then, I have played a one-man band. And I want a whole orchestra. And to be able to actually have that orchestra in place at the university, I need inspiration, I need more knowledge on this field. So that's why I'm very happy to be part of the team, and now I think Jenny will explain a little bit about the work of the subgroup.
Yeah, thanks. And to reiterate what Jelena said, this was Heidi led this group, and it's a real shame she can't be here. So this is Heidi's work and she really has been herding cats over the last year. Said that what we didn't want to do was kind of replace the education framework. It's there. And so this is very much building on this to create curriculum guidelines. And also what we didn't want to do was to set a curriculum. Every curriculum is going to be different in every country, in every context, for every group, for every level of education. So it was really about a guideline of what we think a curriculum ought to look like and the kind of broad topic areas and approaches it ought to be. Based on this idea that we would cultivate capacity, values and agency needed across generations to transform health systems and social systems in the face of the planetary crisis. What we've done is come up with a set of guidelines, which it's altogether, there's about 36 chapters that will eventually be an ebook. At the moment on the Planetary Health Alliance website, you can see what those chapter headings are. Each chapter will not be the lesson plan. It will be literally a page of guidance as to what you might want to put into a lesson plan and also links to further resources. The process involved 13 contributors from 7 countries, which are Australia, Canada, Denmark, New Zealand, Nigeria, UK and the US. Peter was the only man in that group. So we were trying to check how many countries we've got, check we've got a good global reach, look at the diversity. Thank you for being there. you made sure we had gender diversity. I also want to mention the Sophia project. I think some of you have seen there have been flyers around as well. Sophia has created off-the-shelf lesson plans, and that was actually one of the reasons that we didn't, because that's already there. And there are various lists of universities across the globe that teach planetary health, many of whom are happy to kind of share curriculum with you. So it is a guideline. As I said, what you will see at the moment is you will see the headings. Eventually there will be an ebook under that. The next stage is we would like to get that laid out more professionally than we're able to do it ourselves, so it does become a document. And we're also slightly nervous and aware of where there are lots of links. Those links can go out of date very quickly. And one thing that we do need to think about in the next stage is what is the process of making sure that something that is link heavy stays up to date and relevant. We did come up with some priorities within this, which said was very much to develop an inclusive planetary health curriculum to make sure it was adaptable across all levels, all ages, all cultural and socio-economic contexts in multiple languages. We haven't really done that as much as we would like, and that was due to the people who had the time to volunteer to be in the group. We want to make sure that is more diverse. So again, those loose guidelines are there to be modified and there to be expanded. We wanted to design a knowledge, skills, values and attitudes framework so we could evaluate curricular effectiveness and impact. That's also in progress. But again, so all of this is there for those of you who would like to get involved to help us. We wanted to provide adaptable educator guidelines. Again, we want to make sure that we're not telling you what to do. We're telling you how this might be done, and then you can adapt it within your frameworks. And as we said, particularly we wanted to create opportunities for child-centred and empowering education. So make sure we are reaching out to those younger age groups that perhaps haven't been as represented much. And it's been great over this conference. I've actually had 3 separate people come up to me and say, I'm either primary or secondary school teacher, how do I get involved? And I can see a couple of them in the audience, so that's been fantastic. If I can figure out how I go on. Yeah, I also want to say a little bit about what it's not. And I've said it's not off-the-shelf teaching materials. You need to develop those yourself from the framework and the guidelines we're giving you. It's not a definitive curriculum that must be followed. So if you think there are things missing, by all means add them in, and don't teach things that are in it that you don't think are relevant to yours. And we're not telling you how to do it. We're giving you kind of pointers in the right direction. And it's not prescriptive to any age, education, level, country or culture. We want it to be loose enough that it can be adapted to make sure it fits the needs of the people you're educating. If I can get the slides to work. So what we did is altogether, there are about 30 chapters, but we organised them into 4 sections of the group. The first one, which is a reasonably short section, is an introduction and background to what planetary health education is. So a little bit of the history that Teddie gave, a couple of the key documents, but we're kind of assuming that by the time people get to this, they know what planetary health is, and if they really need a lot more information on what planetary health is, that's somewhere else. So this was really a broad overview section. But the meat of the book is really in the second section, which is pedagogies of planetary health. It's how do you teach planetary health and what is important about that planetary health teaching. And that's really what is unique about this book and what hasn't been covered before. We then do go briefly into, again, content areas for planetary health education, which is largely pointing you on to where you can find those. And then a section on finding solutions. So when you've educated people, what do they do with that? How do you actually go and make sure they can take that out into the real world and use it to make change? And I said within that, there are these short sections under each one that give you further information. But this is really about that pedagogies of planetary health. That's the key point of this book. It's how do you teach this? How do you actually take this out into schools, into high schools, medical schools, universities, the community, and make sure that this works for everybody? Oh, and then I will hand over to the global nature of planetary health to Jennifer, who was also part of our group, I must say, and has written some of the chapters of the book.
Hi, everybody. It's so nice to be here with you all today. Before I dive into our Global Nature of Planetary Health project, I wanted to take a moment, as others recognize up here, to acknowledge that this project was truly a global effort. And I'd like to highlight the colleagues and the contributors who helped bring this project to life. Our Global Nature group members included Jelena, Teddie Potter, Tatiana de Camargo, Hina, Shan, and Mubinat Lowell. We also had invaluable support with communications and editing from Yasmina Abdab, Cassie Yandin Tan, and Jasaran Lee. And then finally, members of the Planetary Health Education Action Group helped us to gather stories from people around the world. We're deeply, deeply grateful to everyone who contributed to this project. And again, as was mentioned, these things never happen alone. It really took a group effort. So our goal with this project was to bring forward diverse perspectives on the global environmental crises while emphasizing our shared interconnectedness and the truly global nature of planetary health. We wanted to highlight that no matter where we live, our health and well-being are deeply tied to the health of the planet. And at the same time, we recognize that these challenges do not affect everyone equally. Some communities, often those already facing social, economic, or environmental vulnerabilities, experience disproportionately greater impacts. Making those voices visible was central to our project. They carry important insights, lived experiences, and solutions that can guide us toward a future where all communities can thrive. So our project centered on capturing voices and stories that reflect the many dimensions of planetary health. For generations and across cultures, storytelling has been a way to share knowledge, preserve memory, and transmit values across generations. And in the context of planetary health, it allows us to weave together personal experiences, cultural wisdom, and scientific understanding, creating a narrative tapestry that makes global environmental change more tangible and human. And by elevating diverse voices and perspectives, these stories not only inform, but also inspire, inviting listeners to see themselves as part of a larger, interconnected web of life and responsibility. And so we organize these stories into 3 separate videos. The first one is personal experiences, where people shared accounts of being impacted by various environmental events in their own personal lives. The second is Awakenings, where they describe the moment they first became aware of these issues. And then the third and final is where participants spoke about the actions that they're taking to be part of the solution. And so together, these themes really formed an array, a mosaic of experiences that illustrates both the challenges we face and the hope and creativity alive within our communities. And these stories really do more than inspire, they encourage collective action by showing that everyone has a role to play. We also see these stories as powerful tools for education. And so by watching these real-world stories and voices, students and viewers can connect abstract planetary health concepts with lived experiences in a more vivid and meaningful way. And in this way, the project supports not only knowledge, but also empathy and engagement. And so our hope is with these stories that they spark reflection, dialogue, and action in your own communities. And communities can be classrooms, they can be museums, medical centers, libraries. And they really do remind us that while these crises touch all of us, local voices and local actions do carry the power to guide real change. So thank you.
And Jenny or Ashley, would you like to come back on stage and tell us just very quickly about the policy toolkit?
Yep. This one's much quicker because this one is actually finished and it's all up there on the website for you to take and use. So the idea of this was, when we were talking about policymakers, I used to work in a policy think tank, so I used to work on policy research a lot. What policymakers want is they just want a very quick brief that gives them an overview of the problem and kind of gives them some ideas of what to do. And so we just created a template that people can take and use. And so you can see there is kind of an example. It's on the website as a Word document that you can just download and fill in yourself. What we've also done is done links to where there are kind of other policy briefs that we think are good examples, so you can have a look at them. We did a video overview which just kind of talks you through how to write the policy brief, so that again is there to download. Again, one of the things that we have got, we're very aware that that is a very global north, kind of UK, North American style policy brief. It doesn't necessarily work for other scripts and other languages and other cultures' design. So if anybody else would like to do the equivalent version for their culture, we would be very happy. I think particularly in a Chinese, Japanese, Greek, Russian language with a different script would be good. Ones that go from right to left rather than left to right might look slightly different. And those, it would be great to end up with a bank of kind of 10 examples of the template from different parts of the world. Thank you.
And Stacy will tell us about the webinar that was designed for educators.
Thank you. Hi, everyone. I am Stacy Villegas. I'm the academic program manager within the Johns Hopkins Institute for Planetary Health. And so one of our main priorities for the education program at the university is to embed planetary health curricula across the entire university. And so when I saw this opportunity to volunteer within the Education Action Group, I felt it was appropriate to join such an amazing group of 30 volunteers. And I had the privilege of working within our specific group. It was 5 of us. We had Anusha Sivanrenti from Royal Holloway University, and we also had Ashley Onome from the University of Toronto, along with Carlos Farón Guzman from the University of Maryland, who also works with the Planetary Health Alliance, and of course, Jelena Malogajski, who also joined us. And so, as we had this assignment to include as many educators as we could from around the world, we decided to run our first pilot webinar. And so we wanted to be as inclusive as possible. So we had 2 sessions. one in the morning and one in the PM session. And so, as you can see, the map over here, we had folks join from all over the world: Oceania, Southeast Asia, North America, of course, and South America. And so we had a total of 265 participants from both the AM and the PM group. And one of our main goals with this webinar was to really mainstream planetary health, but also inspire educators, as I mentioned, from any discipline to really understand what planetary health is and what the importance of it is to teach. So we also wanted to take this opportunity to essentially conduct an informal needs assessment and see how we can provide assistance to these educators on how to embed planetary health curricula into their classrooms. And so, as I mentioned before, the target audience was really any and all educators from around the globe. And so we asked about 3 different questions, and we used Mentimeter. For those of you who may not be familiar, it's a platform that allows higher engagement. So the first question we asked was, are you currently teaching planetary health? And we added the last one, as you see, am I? Maybe. Some educators might not know if they are or not. If you are touching on a subject like One Health or EcoHealth, you're like, I don't know, is it considered? So we just wanted to be as inclusive as possible, but it seemed like the majority of our participants were. And then we go to the second question, which is, if you are currently or interested in teaching planetary health, what age group or audience do you focus on? And so, as you can see, as to what we also assumed, the #1 group was higher education. And then we were hoping to have a bit more of a primary and secondary population, but it was also amazing to learn and see that lifelong learners were the second runner-up. So it's just great to see that people who are not educating currently, but still want to know what planetary health is really just moving. So that's were the main results here. And then we go on to the third question, which is, what support or resources would help you start or improve your planetary health teaching? And so, as you can see, we have all of these amazing answers, such as case studies, quizzes, community engagement, syllabi reviews. So we had all of these amazing answers from both the AM and PM session. And this is just such vital information to have, so that within the next year, when we're all working together and picking this work back up, we have somewhere to start. But I think it's really important to see how we're actually going to utilize this information next. And it's just also amazing to see the community that we've been able to create and hopefully keep moving it forward as well. So I just want to say thank you all to the working group members, because this was just such a pleasure working with you all. So thank you.
Thank you, Stacy. And I just want to take an opportunity to also share all of this that we talked about today in the second part of the session after the panel. All of these resources, so all 3 global nature planetary health videos and the policy toolkit and the planetary health curriculum guidelines, all this can be found on the Planetary Health Alliance website, and we invite you to explore these resources and also share them within your networks. And finally, I would like to just invite Ashley on stage to tell you a bit about the next steps and where is that we would really appreciate your help and support. What are the resources that we still are working on, and how you can contribute to those if you wish to do so.
Thank you so much. Hi everyone, I'm Ashley Amone. I'm an assistant professor at the University of Toronto in the Dalla Lana School of Public Health. I have the honor to have the last word, but this is actually an important one because this is now like our what next, our call to action. And we were trying to think of ways of continuing to develop these materials, definitely some of them like the curriculum guidelines, are kind of a work in progress and it needs more input. So how can we sort of gather inputs from all of you and all of your colleagues and networks? So, so one thing that we're going to try is we've set up a Padlet, and you can access it with this QR code. And what we've set up here is basically 2 areas where you can contribute to either the curriculum guidelines or the policy toolkit. So as the other speakers mentioned, the curriculum guidelines, like, you know, there's some parts of it that need to be fleshed out more. We would love more input from primary and secondary school educators. And then maybe if there's things that you feel like should be added to the guidelines, feel free to suggest. So this is where you can add your suggestions and inputs. And then also for the policy toolkit, like Jenny mentioned, we could use inputs from other regions, maybe other examples, maybe adaptations to other languages and cultures. So you can put your suggestions in here as well. And then if you have any other suggestions for the working group, or if you'd like to join us, there's an other column for sort of any other suggestions or inputs. So we'll keep this Padlet open until the end of the year. So feel free to add your suggestions. Maybe do it like in the next hour so you don't forget once you leave the conference. But in the next few months, we'd welcome your inputs, and we'd also welcome your membership and support. Thank you so much.
Thank you so much, Ashley. And I would just like to say thank you to, I hope we have a few minutes left for the discussion. I would like to thank our panelists today, Husein and SanYuMay and Hina. If we can please, if Hina is still online. I just hope that we have time for a couple of more questions, where we are on time. We passed the time. So then, as I thank you again, it was just like a very full session. We did get some questions in the middle of the session. I want to thank you again, and I want to, just as you are exiting, we're going to play one of our videos, the shortest one, and that is, because we were trying to decide which video would be the best one to wrap this up, and obviously with the lack of time, we're going to go with the shortest one on awakenings. So I would like to ask the tech room to please play the video, and I really hope that we will hear back from you and get all these contributions to our work. And please feel free tomorrow to find us and connect with all the members of the Education Action Group, and we'll take that conversation. And we can answer then, of course, some of your questions as well. Thank you.
Hi, I'm Melissa Vera. I'm an associate professor at Washington State University in the College of Nursing and the College of Medicine at iReach. I'm a Tsimshian and Yaqui First Nations. I'm from the Wolf Clan. My Tsimshian name is Goipa Lakhdao, which means sun on the frost. But it was definitely a conversation around the table in the 90s with my parents and myself. And I remember crying about killer whales. They're very, very important to my tribe. And for my birthday, all I wanted was to adopt a killer whale. My mom got me an adopted killer whale for the year. I mean, essentially it was like a donation to a wildlife fund that helped save the ocean. But I got a picture and everything. Her name was Onyx. I've become more and more aware of it as I've grown in my career, especially with my people. Among many tribes, we're losing our medicines, we're losing our ancestors. The closest one to my heart is the salmon. And the salmon feed the killer whale, and the salmon feed the bald eagles, and there's actually literally DNA of salmon in the cedar trees and in the forest, because the eagles eat, you know, the really delicious parts because they're abundant, and they'll drop the rest of the fish right into the trees, and it feeds the forest. And the red cedar, which is our medicine, which is our ancestor. And now that we've been overfished and the salmon are not spawning the same way and the numbers are just not coming back the same way, especially to feed the tribe, to feed killer whale, to feed the trees, to feed the eagles. That's how I've really come to know it in my career, and I've come to know it within just my tribal people as well. For me, I want to keep pushing what I do and put planetary health on things that are very indigenous, which really emphasize the interconnection that we are land and land is us.
I'm a planetary health enthusiast, and my awareness of environmental crisis began in 2020 in a very personal way. I was involved in chicken rearing. One day, on my way to sell the poultry, I came across a large heap of waste, that is, wine bottles, plastics, and other debris. They were all scattered along the lectures. The sight fixated about me and couldn't stop thinking about the pollution and its impact on the lake and surrounding life. Realizing the severity of plastic pollution has noticeably changed with several areas of my life.
I'm a nurse. I'm a mum of two. My children are late teens, early 20s, and I've been interested and concerned about the environment and its impact on health for a number of years. I first got interested when I saw some social media post about the dangers of idling engines, and it's all gone from there, really. I joined a community group looking at litter pickups, those kind of things. And then I started to think about how is this impacting on things for my patients and the organisation that I work for.
Bonjour, moi c'est Christelle et moi soutien ici. Voyage dans la santé planétaire a commencé le 12 janvier 2010 après un tremblement de terre une fois pays. Moi t'es là ça t'est arrivé et moi qu'a dit que tout bagage changé en moins de quelques secondes. L'école casée, caille casée et en pile monde perdu la vie au jour ça. Nous t'es resté sans de l'eau propre, sans manger et sans accès à soins santé. Et puis on l'autre malheur frappé nous encore. Après tremblement de terre, t'es un volontaire qui est sorti de l'autre pays qui vient aider. C'est là ça moi réaliser un bagage. Santé nous, environnement nous, marier une avec l'autre. Et le système ça a échoué, surtout dans la communauté vulnérable, conséquences sur tout le monde. Moment ça, c'était moment réveil moi.
You know, that's the thing about a planetary health awakening, that I'm not sure that I can find one emotional, lightning strike moment that touched on that emotional component for me, but I can say that there were things in the planetary health course helped to kind of tease out the personal. So there were activities where you're supposed to measure how much water you use in a day. And I've never thought about how much water I use in a day. Even turning on the tap to take a shower or to brush my teeth, starting to accumulate an understanding of my own sort of consumptive patterns. And then comparing that to what, we were reading about in class about shortages, it did feel a lot more personal. And suddenly my attention was really on my own actions.
So as a kid, I was very much one of those nature collector types. So I was always interested in ornithology and entomology. I spent hours as a kid. I was born on and raised on the prairies. And so in Regina, I could walk out into the fields and find sluice ponds, and I was obsessively interested in the world, plants, animals. While I was studying philosophy at Queen's with colleagues of mine, that's when I started to get involved in environmental issues, environmental ethics. And what they were particularly interested in was the desiccation of the Aral Sea. So the Aral Sea is was at the time, fourth largest body of water, inland body of water, larger than all the Great Lakes except for Superior. And since the 1950s, because of consumptive withdrawal of water to irrigate the desert to grow cotton, this is a long story, the sea started to disappear. As a consequence of that, that's where I first noted that climate change has its impacts on health and population, because basically the Aral Sea was like a modulator of the local climate. So as it disappeared, winters got colder, summers became hot. As the sea desiccated, industry that was based around the fishing industry in the Aral Sea disappeared. As a consequence, a lot of people left the area. That's where we started to think about environmental migrants. So that was around 1999 to the early 2000s. And that's when, if there was, quote unquote, an awakening moment, but it was certainly a constellation of how all of these forces interact, their complexity, and their impact on health.
Pour moi, santé planète là pas un mot seulement. C'est justice, c'est dignité et c'est vivre.